Welcome to the open mic session. Now then, this is, you will all understand, we've never done this before, have we? So this is something that's completely new. And when we asked you at registration to sort of bring forward some questions, we've chosen just a few, and Catherine will tell me how much time we have, I know, but we'd actually like to get through them, and some of us actually really quite laughed at some of the questions. They were fabulous. But Jude is going to explain now how we're going to run this session.
Okay, so just to recap, Jacqui and I will call on the person who originally asked the question to read it out, and if needed, give a bit of background, a bit of context. Then we would like people who think that they have an answer to put their hands up. Now we would like to try and get through about 4 questions, so please forgive us if we do have to move you on a bit. As a bit of a note, Anne and Catherine have the mic, so beware. If no one puts up their hand, they will know the people who should know the answers, so.
And if nobody puts up their hand, we'll keep on speaking, won't we? So that's a fate worse than death. Right, okay, first question is from David Philbrick, Stockton, Redcar and Tees.
I do think this is an extraordinary project. There's much to celebrate. We've heard a lot today that we can celebrate. But as a dad said to me last week in an anxiety disorders pathway event that we were holding, if you cut funding and cut staff, you can't expect to continue to improve services. Now, I don't agree with him completely about that, but I think there's much about what he said that was exactly right. And we've heard from Norman Lamb this morning about some of the background work that's going on that's going to be enabling. But whilst we continue to face local authority cuts and we continue to have crest cuts in relation to our services, I fear that the embedding of Children and Young People's IAPT project is jeopardised. And my question was about wanting to try and think about both to hear what is being done nationally, so an update from that point of view, perhaps from the national team, but also to think about what we can be doing locally to address this. Thank you.
Shall I pick up the national bit? I think we all heard, sorry, I'm Catherine Pugh, I'm the CYP IAPT programme lead for those of you who don't know me. And can I just check that everybody understands what CRES is? No? Okay, it's cost releasing efficiency savings. Yes. From a national perspective, you heard from the Minister this morning, there's a lot of work going on nationally to increase the profile of CAMHS and of children and young people with mental health problems. We're moving into a new spending review period, so in the central team we're spending a lot of time lobbying, I can't lobby, can I? Because I work for the government, so I can't lobby it. But we spend a lot of time doing briefings and doing work, and Jacqui does a lot of work in the centre to try and make sure that children and young people's voices are heard. And certainly, just to echo the comment that Jacqui made about the document that was published last week, we spent a lot of time making sure that children and young people were woven into it, not kind of a blob at the end or one line at the beginning. So we are trying at a national level, but now what would be great is to hear what people are doing locally.
Jacqui again, I'm afraid. Children and young people... Sorry. Children and young people number 1.3 million, I think they said this morning. Well, for every 1.3 million, you've usually got some family attached to them, whether they're parents, step-parents, carers, whatever. So that makes 2.6 million if they've got a pair apiece. And the parents, carers, are all voters. So I would challenge you in CAMHS to harness parent power for your lobbying, because we could be a powerful force.
Bill Badham. I just wanted to respond by saying that one of the ways that you can look at the embedding is in this room now. One of the joys for me has been perspective, that we had the privilege of being at the beginning of Children and Young People IAPT back in the early sort of 2011, and the 9 issues that the young people at that point developed the testimony today is how far at a local level you have taken those thoughts, those ideas, and embedded them. Now, clearly, money and government backing helps, but I think what we've also heard is that you're doing it because it's the right thing to do. And I'm confident, and I think Fiona alluded to it earlier when you're on the stage, that there is a fantastic shift in culture which will struggle in financial difficult times, but will not be bowed by it. The three things that I thought stood out to me as challenges that show us the way forward was first in the direct one-to-one aspects. I see it as the entrance to our house of participation. There's clearly been lots of progress around involving children and young people in initial assessments, and as we've heard, the session-by-session monitoring and how we're doing. We hear less about independent complaints and advocacy. We hear less about, not saying it's not there, but we hear less about, so what do we do when things aren't working? And how is that stitched in our organisation? Second room in the house about the sort of organisational aspects, we heard a lot, particularly from examples from the GIFT young people, about recruitment and training of workers and so on. But we hear less about what does it mean for clinicians to hear the voice of children and young people in the supervision and appraisal and review process. Not children and young people necessarily being in the room, that's rather sort of, but how does that feedback loop affect one's own performance management? I think that is a second challenge. And third, at the top level of the house, the strategic leadership, we hear a lot today about sort of mission statements, about access to leadership. What we're also touching on today, which is the point I would want to emphasise, is about openness and accountability to children and young people. And that seems to me the continuing challenge. This is about moving from transactional, you join me and my party to do the things that broadly I'm asking to you that I'm sure you'll enjoy and a benefit to me, to being something like, as we work together, this is transformational. This is changing our culture. And that's what I would want you to hold on to and celebrate today from where we were back in 2011.
I'm Sara Barnes. I work for Pennine Care, so we're a provider of mental health services for children and young people. And I guess we're faced with this challenge as well of services reducing. And the approach we've taken is to actually reach out into our communities and work across boundaries in a very different way, rather than retrench and say, well, we can only provide this because we only have this amount of money. And actually it would be so disappointing and distressing to actually lose everything that we've gained over the last 4 years being part of IAPT, and the benefits that we've achieved and the work with young people. And our approach has been to actually open the doors really and look at the whole pathway, the whole system with our partners, with children and young people. And actually what we found is that because everybody is in the same predicament, there's an appetite for actually using resources really effectively and for working in very different ways, in much more flexible, responsive ways, and rebalance the pathway. So it is possible locally to achieve using resources more effectively and to deliver services to young people that are effective, useful and accessible.
That is such an important point. I mean, we know the sort of health economic environment we live in. We know, because we've heard so many times, that such a tiny slice of the cake is spent on children and child mental health. Nonetheless, to hear the sort of transformation example of what you're doing, to hear everything we've heard so far, to hear the voting power, because of course children don't have voting power, although they're the votes of the future, all of these are important points when looking to see how we work with a structure which is far from perfect, and yet assembled in this room is the sheer will and the skill of people to change things. And I think we've got one more response from the floor.
Very brief. So, yeah, I'll speak up for commissioning. I'm an evil commissioner, but a big supporter of children and young people and CAMHS. So I think to come back to this issue of efficiencies, yes, they can somehow often be be identified. I'd like to agree with the previous speaker about joint commissioning, and yes, local authorities are also very undernourished, as are we, especially when it comes to children's services. But actually to joint commission along the pathway, get them to train frontline youth workers, IAPT is the ideal tool. And that then needs to go back through the political route to local authorities. I mean, we can try and do that on the ground, but it needs to happen up here politically as well. So a good example for London, very briefly, is the Health Commission, the London Health Commission that sits in the Mayor's office. Children and young people are a priority in that, which is good and makes a change, and we ought to make sure that mental health is very much part of that. Okay.
That's great, thank you. And to hear from a commissioner is really good. There's a real appetite for co-commissioning throughout the whole of health, social care, even with education, for us to enable and facilitate the right care package for each individual patient. So great to hear it from a commissioner. Thank you.
Okay, so let's move on to our second question now, which comes from Carey Gurd from Swindon.
Hi, I'm one of the trainees on the SFP course for this year, and something that has come up through our training is about the outcome measures being very individualised, and actually thinking about how can we use them to have a more systemic view of the families that we're working with, rather than just focusing on an individual.
Judith Lask. Well, I think it's an important question, because I think, you know, us family therapists have been a bit suspicious of outcome measures, because they, you know, only measure one aspect, and we like to think of all the things that connect up. But I don't know if you were in the workshop this morning about measures and outcome, but I think that was a very good example of describing why they're essential for people who are family therapists and systemic family practitioners. I think they fit perfectly, of course, with some of our philosophy of collaboration, of participation, of working from the client's voice. They also fit very well with the idea of fitting what we do to what comes from the family, i.e. we don't have the sort of manuals that you just give to people. We adapt what we do, because that's part of our philosophy. I think also, you know, we really want to help people, and I think outcome measures are part of that. And I think no outcome measure measures everything we want to know. That's the value of having a range of outcome measures. I do hope that every person who's working with families is also adding to the group of measures the score measure, which looks at family interactional aspects, because I think that's going to help the field tremendously to understand a little better the sort of focuses that we need to have in our work when particular presentations or issues come up. But the whole thing about hearing what other people are saying and using it is utterly fundamental. I think the key thing is that a measure is not just a measure, it's a process. So the whole process of gathering it is the beginning of a conversation. You know, just as a diagnosis is the beginning of deconstructing the whole thing and understanding it in relation to the person. So it's the conversations that go on around the measure with the clients, with the parents, with the children, with the young people that are absolutely key to making the best out of it. They're useful in supervision to help us understand, alert us to difficulties, and also to document change. You know, that's something we work on a lot in SFP, you know, picking up on tiny bits of change and talking about them and highlighting them and so on. And measures are really helpful for doing this. So I think it's how you use them that's the most important thing in this. You don't have to, always be doing systemic things, but always think systemically about them and understand how each little thing you do connects with all the rest. So, you know, as an SFP person now, you know, just work hard at that, because I think we need to claim outcome measures. We need to use them in our particular way and what is most useful to our field.
That was pretty full. Thank you.
No, it's brilliant. No, it's brilliant. Thank you.
Jude, can you see anybody else from the floor?
Anybody else want to add to that?
Perfect.
Yes.
Thank you. Yes, the showstopper. In fact, can we record it? So, the third question is from Tony Ross from Northumbria.
Yeah, I'm pleased it's up there because I can't remember what the question was. I suppose it's about trying to ensure sustainability, and we're training the trainees in the third year now. Yeah, starting the fourth, and we are skilling them up both in the supervision, in leadership, and the different modalities which have grown on year. But we're also in times of austerity and different pressures, and we're not sure what's going to happen with CYP IAPT after this year, and it's how do we ensure that the skills and knowledge that we are trying to develop for the benefit of children, young people, families and carers are not lost to austerity and some of the pressures from organisations. And we might say that we're doing a good job, but how do we measure that, how do we research that, and how do we make sure that it's happening and we're not losing people to duty rotas? So that was what was going through my head.
Right. There's somebody from the programme who can answer this.
That's a wonderful question, but let me answer it in a perhaps overly sophisticated way. One of the, as Tomasello, one of the great evolutionary developmentalists identified, one of the things that marks us out as a race, as a species, is what he called the wretched theory, that human beings have a culture, and the property of that culture is for that culture to be transmitted to the next generation pretty much identically as it was before, except when a better idea comes along, and then the new idea is adopted, and then the new idea gets passed on. It's the wretched theory. My sincere hope in relation to your question is that we have actually found a better way of working, that CAMHS have actually identified as a culture, as an organisation, a better way of working that takes participation seriously, that takes children's, young people and parents' voices more seriously, and that can never go back. You just can't change back regardless of what happens. That we've taken accountability more seriously than we had done before, and that can't go back. That we've taken the idea that there are treatments that are evidence-based, that are more efficient, more effective than treatments that perhaps we have been using in the past, and that idea can't be taken back. That ideas really survive regardless of the money that's supporting them. Now, unfortunately, there's one proviso with that. Ideas do not survive on their own. Ideas die on their own. Ideas survive if they are supported by a chorus of approval. It has to be the culture that owns those ideas. It has to be us that work together collaboratively to adopt those ideas and live by them, regardless of the hardship. And it is really my very sincere hope that CYP continues to flourish for eternity, but in addition to that, it's my sincere hope that actually we have learned an important lesson, and that cannot be unlearned, and that we shall carry on in a way that serves children and young people better than it has done in the past.
Can I just ask Anne to say something about hearing the voice of trainees and research and the audit, the rapid audit that we're just about to do?
Miranda's going to introduce the audit to you later on, but one of the key things that we want to gain from the programme at the moment is to demonstrate the impact it's having on the services, the partnerships that we've set up, both from, the aim and part of the answer to that question is we are hoping that the partnership and collaboration between the higher educational institutions that are delivering the courses and the partnerships and those who are commissioning training will be maintained and sustained beyond the programme's time and funding. But in terms of the audit we're doing to demonstrate the impact, we will be, with a small number of CAMHS partnerships, be looking at the impact the programme has had from the staff's point of view, from the service leaders' point of view, supervisors, commissioners' point of view, and also from the young people and parents who have recently experienced care within that service, to see how well it's been sustained. For the partnerships that have started the programme and started to embed the principles in year one, are those trainees still working to the principles of the CYP IAPT programme now that we're third year, 3 years down the road? But also, how has the whole culture of that service changed and within the CAMHS partnership? So through the audit, we are hoping to pick up on some of the facilitators and barriers to embedding and sustaining the principles of the programme, and we hope to have learn some lessons from the data that we gather through that audit. But we'll hear more about it from Miranda later on today as well.
So for instance, Kevin Mullins, I'm National Programme Director across the whole programme, so I have the benefit of looking across both the adult and the children's programme. And just on Peter's point about unlearning, I sincerely hope, fervently hope, that we will never unlearn the lessons we've learned from the whole system approach we've taken with CYP IAPT, and also the adult programme as well. But there are three things that we are doing practically and slightly more prosaically to make it so. And I think I'll just rehearsing those. Continuing with the level of political support through and into the next government is pretty important to us, and it's got us largely to where we are today in all sorts of ways. And I'm sure Norman was on form this morning, being buoyed up by the announcements from last week and the vision for 2020. Hang on to that thought, that's still there, and it's still going to drive the system. And we will have targets, and we like having targets because they're quite handy, really, although they're so last year, I must say, but anyway. The second thing we're doing, and many of you are involved in this, is the work around accreditation. So accrediting individuals and services and so on. Coming up with a kite mark that convinces commissioners and people pay that actually if you do it like this, to this standard, you will get these results. It's pretty important. And if you don't have a kite mark, you won't be in business. That's pretty important for CYP. It's equally as important for the adult side. So that's the other fixed point we're aiming at. The last one, and this is to land this truly and squarely with commissioners, and also the providers, is getting a sensible outcomes-based currency. The principle being, if you do it well, you will deliver the outcomes and you will be paid for achieving those outcomes. And there's a broad definition of outcome, both clinical and non-clinical, patient satisfaction, choice, and so on and so forth. And we're certainly working very hard on that on the adult side, and I know that work has been done on CYP more broadly into CAMHS. So those are the three things that I think are going to push us ahead towards sustainability. But I think Peter's point about not unlearning, not changing the culture, because we know that that is what works and what service users and families need and communities need, is really the real driver for all of us in this room. So I hope that helps. Thank you.
That's very helpful. Thank you, Kevin.
Can I just add one thing as well, which is we've got colleagues from Health Education England with us today, which is fantastic. And one of the things that I would say to every single one of you who has any link at all to your training programmes back at the ranch, Health Education England and local education training boards commission what you want to buy, not what I think they should buy, but what you want to buy. So one of the things, picking up on Peter's point about learning, is that actually one of the, if we value what we're doing now, we should be commissioning places in the future. So this isn't something that we all look back on in 10 years' time and say, do you remember CYP IAPT, wasn't it great? Because actually the courses that we're running now should be embedded in core learning for professionals coming forward. They shouldn't be subject to a programme funding. They should be part of routine business for Health Education England. Now that will not happen. It's in the mandates, but that will not happen if you and your trusts, those of you who are from trusts and voluntary sector organisations, because Health Education England has a mandate for training voluntary sector and a local authority, if you do not ask your local education and training boards to commission courses like this, then they will not exist. So every single one of you, I would like you, if you're from a trust, from a local authority, from a voluntary sector organisation, when you go back to contact whoever does your training and say, what questions are you asking about the future of child and adolescent mental health services training on our patch? Because if you want it to continue, you have a voice in doing that.
Thank you, Catherine. Now, fourth question.
Okay, so the last question is the one that made us laugh. It's from Alex Goforth in London. I'd like to stand up, Alex.
Right, so my question is, if you could only choose one bit of the programme to save in the event of a fire, which bit would it be?
Well, being a participation officer, I would say participation, definitely. Mostly because, like people say, it is the driving force behind, I think, CYP IAPT. And, you know, if it's all about having a voice of the young people, then participation is the biggest part of that. As I'm sure everyone can agree. Well, I guess that's my view, and I guess that might be me being a bit biased because I'm a participation worker, so, yeah, that's me.
Well, I just want to say bother, because that's what I was going to say, but from a service perspective, because I totally agree. I said it earlier, and I really believe it, that without participation, we couldn't make change happen. And close second to that would have to be routine outcome monitoring. I was thinking about the previous question, and for my sins, one of the things that I have to do is look at complaints. And increasingly, and it picks up Jacqui's point about parents as voters, but increasingly young people and parents as customers are wising up. And if they come to our services and they've had a year's worth of treatment and nothing has changed at the end of it, actually they want to know why, and I think our commissioners will want to know why. So my number one fire rescue would be participation, and my number two would be outcomes.
I would follow the health and safety direction, really, and head straight for the exit and not collect anything in the confidence that IAPT is embedded across the country and will survive despite me.
Yeah, it's a good one. Any more?
Hi. Oh, can you hear me? Yeah. Hi, it's Yvonne from the gift team. Despite my T-shirt, I'm not going to say participation. I'm going to say something of which participation is a small part, and that's the values base that the whole of CYP IAPT is predicated on. That's what I would say.
Thank you. Any more? Looks like we've saved it all then, haven't we?